Hi, welcome to week 4 of the Building a Financial Case for Your Telemedicine Program. I'm going to change it up a little bit. We were originally I was going to have you build a financial model, but I think it's a little too much for the scope of this class. So what I'm going to do instead is I'm going to go through a brief PowerPoint presentation. I'm just going to go through the first third of it to explain the value proposition of each of the different stakeholders. And then what I'm going to do is I'm going to post that presentation. There's going to be more detail, so I would suggest you review it. And then you'll notice that I revised the assignment just to give a description of what you think your value proposition is. I think that will reduce the heft of the assignment and will not be so challenging, especially when there hasn't been a full background in the financial aspects of telemedicine. So enjoy this presentation. If you have any questions, contact me. But I think just a couple of paragraphs, 1 to 5 paragraphs on what you believe, who you believe your stakeholders are and the value proposition, I think would be beneficial and would accomplish the same thing. So hold on 1 second. I'm going to share my screen and then we'll start the presentation. Okay, so we're going to ask why telemedicine. What are the reasons why the telemedicine project will generate interest among the various stakeholders? One of the hold on 1 second. So the first is that telemedicine it does strengthen the care continuum. It also facilitates provider collaboration, extends resources, enables care for the polychronic, which we've seen in some of the readings. It also improves access to care and quality as well as revenue, reduces costs, and avoids costs, which are quite different. But a lot of the value proposition is going to depend on who the stakeholder is. It's going to depend on what the problem is that they want to solve, and also what is the desired outcome? Why are they implementing telemedicine? Is it just because it's cool, or is there an actual value proposition associated with it? So there are a variety of different stakeholders who do benefit from the implementation of telemedicine. One are hospital administrators. And we'll see why. Physicians, both primary care as well as specialty care, store and forward physicians, health system administrators other than operating administrators, but strategists, business developers. Some of the academic hospitals have medical staff recruiters, which telemedicine shows well. And then, of course, back to managed care, the accountable care organizations, and patients themselves. So let's look briefly at some of these stakeholders and what the benefits are that each of them will receive. So if you're a hospital administrator, you're going to want to increase the revenue. You want to leverage the bench strength of your physicians. You can do this if you implement telemedicine that can be non-dependent on geography. So you no longer have to worry about, hey, I can only leverage my physicians for the people that can come to our facility, especially with store and forward like radiology and dermatology, or also fertility consultations, genetic screenings. There's a lot that can be done regardless of geography, and there's quite a bit of revenue that can be generated by organizations who want to leverage, especially their brand, really internationally. You can embrace medical tourism. Some organizations have a second opinion offering where maybe their local physicians or hospitals offered an opinion, but there's an expedited process. I know the Barrow does this. I know Johns Hopkins does this, so that you can sometimes skip the line, but at a minimum you get a more interesting group of individuals that have more complex problems, and that sometimes is very aligned with the strategy of a particular organization. Increasing the census. Census is another word for basically filling the beds in the hospital. So by expanding connections to community, rural entities, whether it's hub and spoke offerings like Telestroke, all of these increase the transfer. So once the patient is stabilized in the local emergency department or in a unique urgent care facility, then having that patient stabilized and shipped to a quaternary facility is often or will benefit to both the rural communities as well as the urban hospital. Oftentimes the community physicians have a go-to specialist that they want to use for, like if they're an oncologist, they may want to have a surgeon that they particularly like to work with. And so by working with, by transferring images back and forth, there's a likely increase in referrals. Strengthening ties with skilled nursing facilities is another option, and improving emergency throughput. So all of these are ways to generate revenue using telemedicine. So how do you, hospital administrators also want to reduce costs or avoid costs. So they can reduce readmissions by providing remote patient monitoring. Oftentimes if someone has some of the designated disease states that the Medicare has said, hey, if people come back within 30 days, we are not going to pay you again, and we're potentially going to fine you for that person returning to the hospital. So, so that's one thing that telemedicine can do. It can reduce that bounce back. Also, there's ways to reduce costs. I mean, you can spread your specialty resources across a wider geography. So if you have community hospitals, standalone emergency departments, urgent care clinics, even physicians, you can leverage your specialists across your entire care continuum. You can expand patient education without adding human resources. You can reduce the length of stay potentially, reducing inappropriate ED use or moving things further along, optimize resources, and you can use employed versus contracted resources, which is also really positive for states that do allow an employed model. Also, enhancing the patient experience, improving patient outcomes, offering ways, using telehealth to connect people with their loved ones if they're, you know, or places like Arizona, Florida have a large elderly population whose family often lives in other locations. So using telehealth to connect with the patient, participate in your family member's care is a way, not just in the NICU and PICU, but also in some of the other areas where they're often dealing with elderly or the very tiny. And you can also get quicker access to specialists in the ED. You can improve your HCAHPS scores, reduce admissions, and gives you an extra layer of clinical focus. So primary care physician benefit, they like it because they can potentially increase the amount of patients that they have. Once again, if the patient is in Arizona but can't reach them, maybe they, if they do it properly, they can increase their patient telehealth connection and possibly manage a larger panel of patients through remote patient monitoring or even just low acuity visits. It also, you know, the primary care physician can get people in and out faster if they're screened via telemedicine. And if they're seeing someone via telemedicine, that opens up an operating room or a patient care room for someone who's actually in person and maybe more serious. Allows the physicians to practice top of their license. So they're dealing with more complex patients and not the sort of sniffles and colds that they often find jams a primary care physician practice. So physician specialists, they found with global billing, a physician can decrease the cost because they can see patients pre and post-op via telehealth. Sometimes outcomes are better because they're using remote patient monitoring, which can herald a change in the disease state prior to the person coming in to see you. Patients can sometimes get referred from rural facilities, as we mentioned with medical tourism, and it also allows physicians to have tumor boards and collaborate with someone during their surgical intervention by piping someone in via telemedicine. So there's a whole host of ways that you can use telemedicine. Store and forward physicians have found that it's a way to generate revenue because they can read from across the nation, the scans. They can recruit and schedule physicians regardless of geography. So if you have a physician, I know that Banner uses a physician that's located in Israel. As long as they're licensed in the state where they're practicing medicine, it doesn't matter where they physically reside. And it also can expand your practice. So there's a lot of reasons to move forward in this. Health systems like it because patients like to use it, so it attracts more patients into the health system. It provides exposure to new patients that may not have interacted with the health system previously. It positions them as a tech-friendly and more savvy service organization. Positions them competitively, enhances their brand, and adds referral sources. Academic hospitals like it because new residents are like it, and it maybe gives them the edge in recruiting new people, recruiting the next round of residents. It also gives them a way to offer educational and collaboration opportunities worldwide. It also gives a lot of the people the specialists that are often working a really tough schedule during the week an opportunity to collaborate from their homes on the weekends or the times when they're off duty, which reduces the wear and tear on the traveling aspects of consulting physicians. Population health management executives like it because of the cost avoidance. They can avoid urgent care and unnecessary ED visits for low acuity. Remote patient monitoring reduces ED visits. Same with the skilled nursing. Inpatient continuous monitoring, reduced lengths of stay, and the care continuum is extended, aligning the acuity with the care type. Patients like it because they can access their primary care physician without need to visit in person. There's more layers of care, so care coordinator can sometimes get involved, which helps the patient feel connected and cared for. Access to specialists is often improved, as well as connection to others. So as you're doing your assignment, look at who are the stakeholders in your plan and what's in it for them. If you dwell further into this PowerPoint, I'm not going to go into the details, but feel free to look at it. It's all identified as to who they are and what's in it for them. You can see here's an example, a hospital CEO that wants to generate revenue. Here's some examples. It's just another way to present the information that was previously presented. So good luck. I look forward to receiving your submissions. Take care.